Understand your Medicare? Well, today I'm going to go over the differences between Medicare and Medicaid. Hello, good morning everyone. Welcome to my channel. My name is Matt Ragudo. I'm a chartered retirement planning counselor as well as have my certification in long-term care planning. And if it's the first time you're watching, well, this channel is set up to empower Medicare beneficiaries and their loved ones to make informed and educated decisions on their healthcare. And I'm often asked, what is the difference between Medicare and Medicaid? And even I'm asked that, or I'm told by some of my clients that, when I retire, I'm not going to have Medicare because, I'm not poor. Well, Medicare and Medicaid are very different, even though they sound the same, and they're both government-sponsored programs. So today, let's go ahead and dive deeper into the differences between Medicare and Medicaid. All right, so first let's handle the Medicare portion of this little topic here. So Medicare is a federally based program. Medicare is set up for those who are either 65 years and older or have a disability and have been on disability income from Social Security for more than 24 months. For all the age attained Medicare beneficiaries, these are the ones who have reached 65, the Part A is granted to you or given to you if you or your spouse have worked 40 calendar quarters or 10 years. So what does this look like? If you have worked and paid into the Medicare system through your payroll, the Medicare tax, you will be receiving Part A hospital insurance at no charge. Part B of Medicare is the outpatient portion, and that portion for the year 2020 is $144.60 per month per beneficiary. If you had questions about your premium, or if your premium is different than that, you can go see my video on Part B Medicare premiums for 2020. Original Medicare is also granted to those who have certain diseases, and those diseases are as follows. If you have end-stage renal disease, that's permanent kidney failure that requires dialysis treatment or a kidney transplant. You have Lou Gehrig's disease or ALS. Now, having parts A and B of Medicare allow you to purchase or enhance your coverage by getting a Medigap policy, or in certain circumstances, getting a Medicare Advantage policy. Both of those options, you will need to have both parts A and B of Medicare. Okay, so that wraps up the Medicare portion. That's what Medicare is, that's how you get it, and those are the options you have with original Medicare. That's the federal part. So let's look into the Medicaid side. So Medicaid on the state-run side is not an entitlement, or it's not something that you have to work towards to get. This thing is a needs-based system. So Medicaid uses financial qualifications. So that's like assets and income. And what they do is, it is based off of the state. So for my home state, the state of Hawaii, there are income limits, which are a little bit higher than the national average. And these limits do change on a year-to-year basis. So for the most up-to-date information, please refer to our website. Okay, so Medicaid can be used to pay for long-term care, custodial care, and covers pretty much all of the out-of-pocket medical expenses that someone might have on through their healthcare journey. So what happens, or how do I get qualified for Medicaid? Well, there is really two ways to get qualified for Medicaid, and the first way is the financial way, which we've discussed, but there is that second way And that second way is if you have medically necessary conditions that require you to be in a nursing home. So that second qualification is if you are indeed in a Medicaid qualified nursing home. That is one way to qualify you. Also, if your insurance company can go ahead and assess your needs, your medical needs, and puts you at a risk score that would qualify you for Medicaid, that would also be another way to get qualifications for Medicaid. And Medicaid is run again by the state. So just because you qualify for Medicaid in one state does not guarantee that if you were to move or if you were to change some kind of a status, that you would still be eligible for Medicaid. It's not a snapshot per se. Well, they do take a snapshot in qualifying you. If there is a change, let's say you had an inheritance, you sold a house, some of those things, depending on your state, are going to change your Medicaid eligibility. But what happens if you have both Medicare and Medicaid? And that is typically the clients that I see. So if you have both Medicare and Medicaid, you have access to what's called a dual plan or a dual eligible plan. What these plans do is they combine the benefits and give you a more complete or comprehensive package. And what this allows is, especially for those who are on Medicaid because of medical fragility and financial instability or financial, problems, you have access to more social work, access to more qualified individuals to help you receive not only social services but medical services into the home. And while I do in most of my videos talk more about the Medicare supplement route, this is one instance where, for the most part, if you have both Medicare and Medicaid, signing up with a Medicare Advantage program may be to your best interest because of all the additional services that you can receive because you're on both Medicare and Medicaid. I hope this video cleared up some of the, confusion on Medicare and Medicaid, why there's two of them, that they're definitely not the same, and how to know if you qualify for either of those programs. Please go ahead and see some more of my videos down below or send me a comment. All right, have a magical day. Mahalo. See you again next time.